Welcome to the NCLEX practice session. In this session, we are going to deal with some important questions regarding NCLEX. So let's start with the first question. The mother, whose child is generally alert and participates well in classroom activities, is concerned that the teacher now reported that the child has frequent periods during the day when he appears to be staring off into space. The nurse should suspect that child has which problem? Options are 1. School phobia, 2. Absence seizures, 3. Behavioral problems, 4. Attention deficit hyperactivity syndrome. So in this question, it has been given that child is generally alert, but now teacher reports to mother that child sometimes stares off into space, which means there is loss of attention and patient blankly look into space for a few minutes. So we have to tell that this problem signifies which condition. So the correct answer is absence seizures. So absence seizures is sudden lapse of consciousness. It occurs more commonly in children than in adults. They start typically without warning and last for a few seconds. These are also known as petit mal seizures. So if child is suspected of this condition, then it is absence seizures. School phobia, behavioral problem, attention deficit hyperactivity syndrome does not contain these features. Now we will see the rationale. Absence seizures are a type of generalized seizures. They consist of a sudden, brief, usually 5 to 10 seconds arrest of child's motor activities, accompanied by a blank stare and a loss of awareness. The child's posture is maintained at the end of the seizure, and the child returns to activity that was in process as though nothing has happened. School phobia includes physical symptoms that usually occur at home, and they may prevent the child from attending school. Behavior problem would be noted if by more overt symptoms than the ones described in this question. A child with attention deficit hyperactivity syndrome becomes easily distracted, is fidgety, and has difficulty following directions. Now, let's move on to the next question. A 3-week-old infant is brought to the Well Baby Clinic for phenylketonuria screening test. The nurse reviews the results of the serum phenylalanine levels and notes that the level is 1.0 mg per deciliter, that is 60 mol per liter. What is the nurse priority action? So, according to this question, a 3-week-old baby is brought to clinic for a phenylketonuria test. So in phenylketonuria, phenylalanine, an amino acid, builds up in the body, which is due to deficiency of phenylalanine hydroxylase enzyme. So this can lead to damage to the brain. So according to this question, when nurse checks the level of phenylalanine in the blood, that is 1.0 mg per deciliter. So what should be the nurse priority according to this condition? Now let's see the options. 1. Report the test as inconclusive. 2nd, tell the mother that the test is normal. 3rd, prepare to perform another test on the client. 4. Notify the pediatrician that the test is moderately elevated. So the correct answer is report the test as inconclusive. So if the child is brought to clinic in 3 weeks, so we have to tell the test in doubt because the result could not be accurate. Test report should be considered inconclusive because test should be done within 24 to 48 hours of birth and then after 14 days. Therefore, we cannot tell that the test is normal because it is doubtful. Also, this is not priority to tell the client to perform another test, and the level should not be told as in priority. So the correct answer is report the test as inconclusive. Now we see the rationale. The normal PKU level is 0.8 to 1.8 mg per deciliter, that is 48 to 109 millimole per liter. With early postpartum discharge, screening is often performed when the infant is less than 2 days old because of the concern that the infant will lose to follow-up. Infants should be screened by the time that they are 14 days old if the initial screening was done when the infant was 24 to 48 hours old. So the first screening has to be done within 2 days, and then after the 14 days, then only we can be conclude that the result is positive or negative. Otherwise, we have to tell that the test is doubtful. Now, let's move on to the next question. The nurse is caring for a client who is receiving total parenteral nutrition through a central venous catheter. Which action should the nurse plan to implement to decrease the risk of infection in this client? So in this question, it has been told that a patient is having a central venous catheter, which means he has a port through which we are going to give total parenteral nutrition or feed to the client. So according to this question, which action should the nurse plan to decrease the risk of infection through this procedure? So the correct answer is use a sterile technique for dressing changes. Now, as it is mentioned that there is a port called central venous catheter, the risk of infection is high. So we have to keep in mind that while doing any kind of dressing changing, we have to use sterile technique to prevent cross-infection. Client's oral temperature does not reduce the risk of infection. Also, antibiotics are administered if the test is confirmed. If the infection is confirmed, then only we will give antibiotics. Evaluating the leukocyte is also an assessment and it will not reduce the risk of infection. You will see the rationale. Sterile technique is vital during dressing changing of a central venous catheter. CVCs are large bore catheters that can serve as a direct entry point for microorganisms into the heart and circulatory system. Using aseptic technique helps avoid catheter-related infections by preventing the introduction of potential pathogens into the site. Although the remaining options are reasonable nursing interventions for the client with CVC, none of them prevents infection. Options 1 and 3 are assessment methods, and option 2 is implemented after the confirmation of an existing infection. Now let's see the next question. The nurse creates a plan of care for a client with a spica cast that covers the lower extremity. Which action should the nurse include in the plan of care to promote bowel elimination? Options are 1. Use of bedside commode, 2. Ambulate to the bathroom, 3. Administer an enema daily, 4. Use a low-profile structure bedpan. So according to this question, we have to use which method for bowel elimination in a client who is having a spica cast. So spica casts are used to keep thigh bone and pelvis still, which helps in immobilization during fracture. In this condition, patient cannot bend his hips, so it would be difficult to use commode or use bathroom. So the correct answer would be use a low-profile structure bedpan, because if we will use a low-profile structure bedpan, there will be less mobility to the client's lower extremity. Bedside commode could not be used because it will need some kind of mobility. Ambulating to bathroom is very tough for immobilized clients, and enema is not a routine procedure, so we have to use a low-profile bedpan. Now we will see the rationale. A client with a spica cast, body cast that covers the low extremity cannot bend at the hips to sit up. A low-profile bedpan or fracture pan is designed for use by clients with body or leg cast and for clients who have difficulty raising the hips to use a standard bedpan. Therefore, using a commode or bathroom is contraindicated. Daily enemas are not a part of routine care. Therefore, to reduce mobility in this kind and to promote healing, we have to use low-profile bedpan. Now let's move on to the next question. The nurse is caring for a postpartum client with thromboembolic disease. Which intervention is most important to include when planning care to prevent the complication of pulmonary embolism? Options are 1. Enforce bed rest, 2. Monitor the vital signs frequently, 3. Assess the breath sounds frequently, 4. Administer prescribed anticoagulant therapy. In thromboembolic disease, there is formation of thrombus, that is blood clots, which get stuck and cause obstruction in vein and can lead to blockage of lung arteries. If in case clot dislodges and comes into circulation. To prevent this, what is the most important action to include in the plan care? So the answer would be administer prescribed anticoagulant therapy. So we will provide anticoagulant drugs which will lead to dissolve of the clot and it will prevent pulmonary embolism. Enforced bed rest will not reduce the complication of pulmonary embolism. Also, monitoring the vital signs is not related to preventing of the complications. It will only used for assessing the baseline data. Assessing the breath sounds frequently will also not reduce the risk of pulmonary embolism. It is an assessment tool. So the correct answer is prescription of anticoagulant therapy. Now we will see the rationale. The purposes of anticoagulant therapy for the treatment of thromboembolic disease are to prevent the formation of a clot and to prevent a clot from moving into another area, thus preventing pulmonary embolism. Although the remaining options may be implemented for a client with thromboembolic disease, the correct option will specifically assist in the prevention of pulmonary embolism. Now let's move on to the next question. The student nurse is listening to a lecture on serum electrolyte levels and the use of isotonic solutions. Which statement by the student nurse indicates that the teaching has been effective? Options are 1. 10% dextrose in water, which is hypotonic solution. 3% sodium chloride solution is a hypotonic solution. 5% dextrose in water is considered as isotonic solution. 4. 0.45% sodium chloride solution is a hypertonic solution. So in this question, we have to tell that which statement made by the nurse indicates that she has correctly understood the isotonic solution. So isotonic solutions are those solutions that contain the same concentration of water as solute as the cell cytoplasm. So the correct answer would be 5% dextrose in water is considered as isotonic solution. Now we will see the rationale. 5% dextrose in water is an isotonic solution, which means that the osmolality of the solution matches normal blood flows. Other examples of isotonic fluids include 0.9% sodium chloride solution and lactated Ringer solution. 10% dextrose in water and 3% sodium chloride solutions are hypertonic solutions, which means they contain more amount of solute than the water. And 0.45% sodium chloride solution is hypotonic, which means there is less amount of solute than the water. Now, next question. The nurse is admitting a client who recently underwent a bilateral adrenalectomy. Which intervention is essential for the nurse to include in the client's plan of care? First, prevent social isolation. 2, consider occupational therapy. 3, discuss changes in body image. 4, avoid stress-reducing situations. In bilateral adrenalectomy, it is a procedure in which there is removal of both adrenal glands, which are situated on the posterior part of the top of kidney. They are small triangular-shaped glands. In this question, we have to look for the function adrenal gland performs that will lack in the patient's body after removal of adrenal gland. So the correct answer would be avoid stress-reducing situations. So adrenal gland is very important for maintaining homeostasis in the body to fight against the stress. So if there will be absence of adrenal gland, it will not able to function properly, and the stress-producing situations will lead to crisis in the body. Preventing social isolation is not the priority in the client. It is not related to this condition. Considering occupational therapy is also not related to this condition. Discussing changes in body image is not related to this condition because there will be no change in the body image. Now we will see the rationale. Adrenalectomy can lead to adrenal insufficiency. Adrenal hormones are essential to maintaining homeostasis in response to stressors. None of the remaining options are essential interventions specific to this client's problem. Next question. A perinatal client is admitted to the obstetric unit during an exacerbation of heart condition. Which planning for the nutritional requirements when? Which dietary intervention should the nurse consult the dietitian about? Options are a low-calorie diet to prevent weight gain. Second, a diet low in fluids and fiber to decrease blood volume. 3, a diet adequate in fluids and fiber to decrease constipation. 4, unlimited sodium intake to increase circulating blood in volume. According to the question, patient is having increased severity of heart problem. While planning nutrition requirements, what should a nurse seek advice from the dietitian? Okay, so the answer would be a diet adequate in fluids and fiber to decrease constipation. This is the correct answer because if fluids and fibers would be enough in the body, so there will be decrease in constipation, which will decrease stress in the body. A low-calorie diet to prevent weight gain. This is not the correct answer because low-calorie diet will lead to decrease in energy and can affect the fetus. A diet low in fluids and fiber to decrease blood volume. This is not a correct option because it will lead to hypovolemia and will lead to fetal distress. Unlimited sodium intake to increase circulating blood volume. We have to restrict sodium in a cardiac patient to decrease the severity of fetal distress. So the correct answer would be a diet adequate in fluids and fiber to decrease constipation. Let's see the rationale. Constipation can cause the client to use Valsalva maneuver. In Valsalva maneuver, there is increase in heart activity and increase in heart load due to stress in the body. So this maneuver can cause blood to rush into the heart and overload the cardiac system. A low-calorie diet is not recommended during pregnancy. Diets low in food and fiber can cause decrease in blood volume that can deprive the fetus from nutrients. It can also lead to constipation. Therefore, adequate fluid intake and high-fiber foods are important. Sodium should be restricted to some degree as prescribed by the primary healthcare provider because this will cause an overload to the circulating blood volume and contribute to cardiac complications. We have to understand that in constipation, patients train and use active breathing, strong breathing, which can lead to Valsalva maneuver. So we have to avoid this. Let's move on to the next question. The nurse is creating a plan of care for a client, prescribed bed rest. Which intervention should the nurse include in the plan to limit the complications of prolonged immobility? Options are 1. Maintain the client in supine position. 2. Provide a daily fluid intake of 1000 ml. 3. Limit the intake of milk and milk products. 4. Monitor for the signs of low serum calcium. So, in this question, patients with prolonged bed rest need interventions to prevent development of various problems due to immobility. So, what could be the best possible intervention from these 4 options? So, the correct answer is limit the intake of milk and milk products. Why? Because intake of milk and milk products can increase calcium level, which can lead to formation of calculi in the kidneys. So they should be restricted or limited. Maintain the client in supine position. This is not a correct option because it can lead to formation of ulcers. So we have to change the positions too early. Provide a daily fluid intake of 1000 ml, which is very less. We have to provide at least 2000 ml of fluid daily. Monitor for the signs of low serum calcium. We have to look for the signs of hypercalcemia because it can occur while patient is on bed rest. So this is also not a correct option. Now let's see the rationale. The formation of renal and urinary calculi is a complication of immobility. Limiting milk and milk products is the best measure to prevent the formation of calcium stones. A supine position increases urinary stasis, therefore, this position should be limited or avoided. Daily fluid intake should be 2000 ml or more per day. The nurse should monitor for the signs and symptoms of hyperglycemia, such as nausea, vomiting, polydipsia, polyuria, and lethargy. Next question. The nurse determines that the tuberculin skin test is positive. Which diagnostic test should the nurse anticipate will be prescribed to confirm a diagnosis of tuberculosis? So the options are 1. Chest X-ray, 2. Sputum culture, 3. Complete blood cell count, 4. Computed tomography scan for the chest. Tuberculin skin test, also called Montauk's test. In this test, purified protein derivatives are injected in the inner aspect of forearm, and the dose is 0.1 ml. So, this test is sensitive to tuberculosis, but it is not a confirmatory test. So, we have to tell that what test is confirmatory for diagnosing tuberculosis. So, the answer is sputum culture. In sputum culture, microorganisms are seen by growing them in a container, and it will confirm the presence of bacteria in the sputum. Chest X-ray will only see physical changes in the lungs. It will not confirm TB. Complete red cell count is not a confirmatory diagnosis because it will only tell about the blood changes. CT scan for the chest is not the best method to confirm diagnosis of TB. It will only provide information regarding the chest physical changes. So the correct answer is sputum culture. Rational. Although the findings of the chest X-ray examination are important, it is not possible to make a diagnosis of TB solely on the basis of this examination because other diseases can mimic the appearance of TB. The demonstration of tubercle bacilli bacteriologically is essential for establishing a diagnosis. The microscopic examination of sputum for acid-fast bacilli is usually the first bacteriological evidence of the presence of tubercle bacteria. Options 3 and 4 will not diagnose TB. Next question. The home care nurse is preparing a plan of care for a client diagnosed with mania syndrome. Which nursing intervention should the nurse include to assist the client with controlling vertigo? Options are 1. Instruct the client to cut down on cigarette smoking. 2. Encourage the client to increase the daily fluid intake. 3. Encourage the client to avoid sudden head movements. 4. Instruct the client to increase the amount of sodium in the diet. Mania disease is a condition in which there is increasing pressure and endolymphatic fluid in the inner ear. Therefore, patient has clinical features of tinnitus, hearing loss, vertigo. So, in this question, we have to tell that which nursing intervention should the nurse include to control vertigo in this patient. So, the correct answer is encourage the client to avoid sudden head movements because if there will be sudden head movements, there will be changes in the cranial pressure and shifting of fluid in the inner fluid, which can lead to vertigo. Cutting down the cigarette is important because cigarette cause vasoconstriction, but this option is not directly related to the vertigo. Increasing the daily fluid intake will increase endolymphatic fluid production, which can worsen the condition. Instructing the client to increase amount of sodium in diet will lead to water retention and will lead to increase in the fluid in inner ear. So the correct answer is avoiding sudden head movements. Let's see the rationale. Mania syndrome refers to the dilation of the endolymphatic system by overproduction or decreased resorption of endolymphatic fluid. The nurse instructs the client to make slow head movements to prevent worsening of the vertigo. Clients are advised to stop smoking because of its vasoconstrictive effects. Dietary changes such as salt and fuel restrictions that reduce the amount of endolymphatic fluid are sometimes prescribed. Next question. A client is admitted to a mental health unit with a diagnosis of anorexia nervosa. While planning care for this client, which primary intervention should health promotion focus on? Options are 1. Providing a supportive environment, 2. Examining intra-psychic conflicts and past issues, 3. Emphasizing social interaction with clients who are withdrawn, 4. Helping the client identify and examine dysfunctioning thoughts and beliefs. In anorexia nervosa, patient has eating disorder. Patient is obsessed about what and which food they eat. They are fearful of gaining weight. They starve or exercise too much or purge after eating. So, what should be the focus of nurse to promote health of that patient? So, correct answer is helping the client identify and examine dysfunctional thoughts and beliefs. So, we have to help the client to identify and examine dysfunctional thoughts and beliefs because this will lead to ventilation of feelings and he will be exposed to his deformities and dysfunctioning. So this will help in recognizing the patient about his condition. Providing a supportive environment is useful but is not related to health promotion. Examining intrapsychic conflicts and past issues is an assessment tool, and it is not related to health promotion. Emphasizing social interaction with clients who are withdrawn will not help in health promotion of the patient. So the correct answer is 4. Rational. Health promotion focuses on helping clients identify and examine dysfunctional thoughts, as well as identifying and examining the values and beliefs that maintain these thoughts. Providing a supportive environment is important, but it is not as primary as option 4 for this condition. For this client, examining intrapsychic conflicts and past issues is not directly related to the client's problem. Emphasizing social interaction is not appropriate at this time. Next question. The nurse is preparing discharge plans for a hospitalized client who attempted suicide. Which intervention should the nurse include in the plan as an immediate resource? Options are 1. Scheduling weekly follow-up appointments. 2. Establishing contracts with available private resources. 3. Encouraging family and friends to be with the client at all times. 4. Providing phone numbers for the hospital and primary health care provider. According to this question, patient tried to commit suicide but failed. Now, while planning discharge, what intervention is needed to plan so that if any type of crisis occur at patient's home and if he tries to commit suicide, so what resources can he use immediately so that actions can be avoided? So the answer is establishing contracts with available crisis resources. Okay, so if we provide contracts, so patients will have a sense of responsibility and he will try to avoid that thing. Scheduling weekly follow-up is not an immediate resource a patient can use or a patient can adapt. Encouraging family and friends to be with the client all the time. Sometimes this cannot be possible for the family and friends to be all the time with the patient. Providing phone numbers for the hospital and primary health provider cannot be helpful. It is not a surety that patient will call through the primary health care provider. Now we will see the rationale. Crisis times may occur between appointments. Contracts facilitate a client's feeling of responsibility for keeping a promise, which gives him or her control. Providing phone numbers will not ensure available and immediate crisis intervention. Family and friends cannot always be present. Next question. The nurse is creating a plan of care for a newborn diagnosed with bilateral clubfoot. Which information should the nurse plan to include in the parent's education? Options are 1. The regimen of manipulation and casting is effective in all cases of bilateral clubfoot. Genetic testing is wise for future pregnancies because other children born to this couple may also be affected. 3. If casting is needed, it will begin at birth and continue for 12 weeks, at which time the condition will be reevaluated. 4. Surgery performed immediately after birth has been found to be the most effective for achieving a complete recovery. So, in this question, it has been asked that what health education should the nurse give to parents who have a child with bilateral clubfoot? So, bilateral clubfoot is a birth defect in which both foot are twisted out of the shape or position. It is also called callus equinovarus, foot pointing downward and outward. So, in this question, we have to tell that what education we have to give to the parents. So, the correct answer is if casting is needed, it will begin at birth and continue for 12 weeks, at which time the condition will be evaluated. So, in early stages, if the patient is newborn, we should avoid to perform surgery and we have to put cast to the patient legs and we have to further re-evaluate the patient for the surgery. Manipulation and casting is not effective in all cases, so this option is incorrect. Genetic testing is wise for future pregnancies because other children born to this couple may also be affected. This can be correct, but this is not the education for the current condition. We have to focus on the current condition. Surgery performed immediately after birth has been found to be the most effective for achieving a complete recovery. So, surgery is not the most effective in all cases. There can be some exceptions. So, the correct answer is 3. We will see the rationale. For the infant with clubfoot, casting should begin at birth and continue for at least 12 weeks or until maximum correction is achieved. So we have to keep in mind that we have to achieve maximum correction through the casting, not through the surgery. At this time, corrective shoes may provide support to maintain alignment. A surgery can be performed. Surgery is usually delayed until the child is 4 to 12 months old. Option 1 and 4 are inaccurate. Option 2 does not specifically address the subject of the question. Next question. Which items should the nurse plan to provide to optimally maintain the integrity of a set of arterial blood gas measurements? Options are a syringe that contains a preservative, a heparinized syringe and a bag of ice, a heparinized syringe and a preservative, a syringe that contains a preservative and a bag of ice. In this question, we have to tell that what equipments are needed if we are going to perform ABG analysis in the patient. So the correct option would be a heparinized syringe and a bag of ice. So if we are going to perform ABG analysis, we have to keep a heparinized syringe because it will lead to prevention of clotting in the artery. Also, we have to keep a bag of ice to store the sample and to send it to the laboratory. So to store the sample effectively, we have to keep it in the bag of ice. Preservative is not needed in ABG analysis. So other 3 options are incorrect. Rationale. The arterial blood gas sample is obtained using a heparinized syringe. The sample of blood is placed on ice and sent to the laboratory immediately. A preservative is not used. Next question. A client is experiencing diabetes insipidus as a result of cranial surgery. Which anticipated therapy should the nurse plan to implement? Options are 1. Fluid restriction, 2. Administering diuretics, 3. Increased sodium intake, 4. Intravenous replacement of fluid loss. So in this question, it has been given that the patient has diabetes insipidus. So in diabetes insipidus, there is decrease in antidiuretic hormone, which can lead to excessive increase in secretion of urine. Excessive urination will lead to dehydration. So diabetes insipidus can occur during cranial surgery, which can occur near to hypothalamus or basal ganglia. So it is a common side effect of cranial surgery. So what should a nurse plan to reduce the severity of diabetes insipidus? Should restriction administering diuretics, increase sodium intake, or IV replacement of fluid loss? So the answer is intravenous replacement of fluid loss. As I've mentioned that in diabetes insipidus, there is excess of urination, which can lead to dehydration. Therefore, fluid losses are need to be replaced. Fluids should not be restricted as there is already dehydration in the body. Diuretic will worse the condition and diuretic will lead to more secretion of the urine. Sodium intake will lead to water retention. Okay, so if there will be water retention in the cells, there will be dehydration in the body. Now we will see the rationale. The client with diabetes insipidus excretes large amounts of extremely dilute urine. This usually occurs as a result of decreased synthesis or the release of antidiuretic hormone in clients with conditions such as head injury, surgery near the hypothalamus, or increased intracranial pressure. Corrective measures include allowing ample oral fluid intake, administering IV fluids as needed to replace sensible and insensible losses, and administering vasopressin. Diuretics are not administered. Sodium is not administered because the sodium level is usually high, as is the serum osmolality. So, sodium should not be administered because if there will be loss of water from the body, so there will be hypernatremia, and giving sodium will increase sodium level in the body more and more. Vasopressin should be given so that urine can be retained in the body. We will see the next question. The nurse is caring for a client diagnosed with dementia. Which nutritional goal should the nurse plan for the for with this client? Options are: one, client will be free of hallucinations. Two, client will feed self with chewing within 24 hours. Three, client will be able to prepare simple food by discharge. Four, client will identify favorite food by the time of discharge. Dementia is a condition in which patient has difficulty in concentrating and he finds hard to perform daily activities. He has memory loss, etc. According to the question, we have to find a goal that will help patient to do things so that nutritional requirement can be met. So the correct answer is client will feed self with chewing within 24 hours. So as the patient has functional disabilities, so we have to prioritize feeding so that nutritional requirement can be fulfilled. In option one, it is given that client will be free of hallucinations, which is not related to the nutritional requirement. In third option, client will be able to prepare simple food by discharge. This is a long-term goal which cannot be done by the discharge. And also, it is very difficult for client with dementia to do such activity. In option four, client will identify favorite foods by the time of discharge. This is not related to the nutritional goal. So the correct option identifies a goal that is related to the client's ability to care for self. None of the remaining options are related to the client's self-care needs. Next question. The nurse is preparing to care for an infant diagnosed with pertussis. Which priority problem should the nurse address when planning care? Options are: 1, infection; 2, fluid overload; 3, impaired sleep patterns; 4, inability to expectorate secretions. So, pertussis is a respiratory disease in which is caused by Bordetella pertussis. It is very contagious disease and it is a respiratory tract infection. So, as it is a respiratory tract infection, we have to address the things that will cause obstruction in the airway. So we have to address that thing first and we have to keep that in priority. So the answer is inability to expectorate secretion. So as child has pertussis, so there will be increase in mucus production. Pertussis lead to development of white layer over the throat, which can cause obstruction impatient for breathing. So we have to keep in mind that we need to implement such actions so that patient can expectorate the secretions and can be able to breathe easily. Infection, fluid overload, and impaired sleep patterns, they are not the priority in this kind. Rational. The priority problem of the child with pertussis relates to adequate air exchange. Because of copious thick separations that occur with the pertussis and the small airway of an infant, air exchange is critical. Infection is an important consideration, but airway is the priority. A deficient fluid volume is more likely to occur in this infant because of the thick secretions and vomiting. Sleep patterns may be disturbed because of the coughing, but this is not critical issue. Next question. The nurse is planning care for an infant who has a diagnosis of hypertrophic pyloric stenosis and is scheduled for surgery. Which intervention should the nurse include to meet the infant's preoperative needs? First, administer enema until returns are clear. Two, provide the mother privacy to breastfeed every 2 hours. Three, monitor the IV infusion intake output and wait. Four, provide small frequent feedings of glucose, water, and electrolytes. In hypertrophic pyloric stenosis, there is narrowing of the pylorus part of the stomach. So before surgery, what intervention should we address to meet preoperative needs of the patient, that is infant? So the correct answer would be monitor the intravenous infusion, intake, output, and the weight. So for performing surgery, we should know that what is the fluid level in the body. So fluid levels in the body should be in normal range for performing the surgery. If there will be hypovolemia, patient can go in shock. Therefore, monitoring IV infusion, intake, output, and weight is very necessary. Administering enema until returns are clear. This is not the correct option because enema will lead to hypovolemia. Providing the mother privacy to breastfeed every 2 hours. We have to keep patient nothing for oral, that is NPO, before the surgery. So this is incorrect. Fourth, providing small frequent meals of glucose, water, and electrolytes. This is also not the correct answer. So the correct answer is monitoring the IV intake, output, and weight of the patient. Let's see the rationale. Preoperatively important nursing responsibilities for the child with hypertrophic pyloric stenosis include monitoring the IV infusion, intake, output, and weight, and obtaining urine-specific gravity measurements. Additionally, weighing the infant's diaper provides information regarding output. Enemas until clear would further compromise fluid volume status. Preoperatively, the infant receives nothing by mouth unless otherwise prescribed by the primary healthcare provider. Next question. A client who was a victim of a gunshot incident says, I feel like I'm losing my mind. I keep hearing the gunshots and seeing my friend lying on the ground. Which strategies should the nurse include when initially formulating a therapeutic relationship? Options are 1. Teaching the client a variety of relaxation techniques. 2. Asking the psychiatrist to prescribe appropriate medication. 3. Encouraging the client to talk about the incident and feelings related to it. 4. Encouraging the client to think about just how he or she is to be still alive. According to the question, it is told that patient is traumatized due to his past experience of gunshots and he's having flashbacks, which is causing anxiety. So what therapeutic techniques we should use to make bond with the patient? So which strategy we should use to formulate therapeutic relationship with the patient? So the answer would be encouraging the client to talk about the incident and feelings related to it. So in option 3, we can see that we are encouraging the client to talk, which means he will be able to ventilate feelings. When he will ventilate his feelings, we have to do active listening. And active listening is a part of therapeutic technique. So if we will do active listening, this will lead to formation of therapeutic relationship with the client. In option 1, Teaching client a variety of relaxation techniques can be helpful to reduce anxiety, but it will not increase the therapeutic relationship with the patient. Asking the psychiatrist to prescribe appropriate medication is not a therapeutic technique. It is related to prescribing medication. In option four, we have not to encourage the client about how lucky he or she is to be still alive, because this will not lead to ventilation of feelings and this will not increase the therapeutic relationship. So the correct answer is three. Rational. When developing a therapeutic relationship, it is important to acknowledge and validate the client's feelings. Although teaching the client relaxation techniques may be helpful at some point, it is not related to the subject of the question. Option 2 and 4 are not non-therapeutic techniques and they do not promote a therapeutic relationship. Next question. The nurse is caring for a hospitalized child with a diagnosis of rheumatic fever who has developed carditis. carditis. The mother asks the nurse to explain the meaning of carditis. On which description of this complication of rheumatic fever should the nurse base a response? So in this question, a patient is diagnosed with rheumatic fever. So in rheumatic fever, there is development of carditis. So according to the question, which statement we have to provide to correctly tell that what happens in rheumatic fever? Options are one, involuntary movements affecting the legs, arms, and face. Two, inflammation of all parts of the heart, primarily the mitral valve. Three, tender, painful joints, especially in the elbows, knees, ankles, and wrists. Four, red skin lesions that start as flat or slightly raised macules, usually over trunk, and that spread peripherally. So the correct answer is inflammation of all parts of heart, primarily the mitral valve. As the term says, carditis. So there is inflammation of the all parts of the heart and primarily involves mitral valve, that is bicuspid valve. In option one, we can see that there is involuntary movements of legs, arm, and face, and this option is related to chorea. So in chorea, there is neurological disorder and there is over secretion and overacting of dopamine, which lead to involuntary movements of legs, arm, and face. And this is not carditis or rheumatic fever. Tender, painful joints, especially in elbows, knees, and ankles. This indicates arthritis. So this is condition of arthritis. In option four, red skin lesions that start as flat or slightly raised macules, usually over trunk, and that spreads peripherally. This is a condition of erythema marginatum. So the correct answer would be two. Rational. Carditis is the inflammation of all parts of heart, primarily the mitral valve, and it is the complication of rheumatic fever. Option one describes chorea. Option three describes polyarthritis. Option four describes erythema marginatum. Next question. The nurse preparing to admit a 7-month-old infant with febrile seizures should anticipate the need for which equipment when planning care for this infant. Options are one, restraints at the bedside, two, a cord cart at the bedside, three, suction equipment and an airway at bedside, four, a padded tongue blade taped to the end of the bed. So in this question, we have to tell that a patient who is 7 months old is gonna be admitted in the ward. So which equipment we need to take at the bedside for when there will be seizures. So the correct answer would be suction equipment and an airway at the bedside. This is the most important thing we have to keep at the bedside, because when there will be seizure activity, there can be increase in salivation and increase in mouth secretion, which can block the airway. So we have to suction the secretions during that condition. And we have to keep airway at the bedside if there will be lack of oxygen, hypoxia, so we have to provide oxygenation. Restraining is contraindicated because it can lead to fracture. A cord cut at the bedside is not necessary in the seizure. And padded tongue blade is contraindicated. We should put nothing in the mouth in the patient having seizures because it can lead to injury to the mouth. Rational. Suctioning may be required during a seizure to remove secretions that obstruct the airway, An airway should also be readily available. During a seizure, the infant should be placed in side-lying position but should not be restrained. It is not necessary to place a cord cart at the bedside, but a cart should be readily available on the nursing unit. A padded tongue blade should never be used. In fact, nothing should be placed in the mouth during seizure. Next question. A 10-month-old infant is hospitalized for respiratory syncytial virus. On the basis of the development stage of the infant, what intervention should the nurse include in the plan of care? Options are 1. Restrain the infant with a total body restraint to prevent any tubes from being dislodged. 2. Follow the home feeding schedule and allow the infant to be held only when the parents visit. 3. Wash hands, wear mask when caring for the infant and keep the infant as quiet as possible. 4. Provide a consistent routine and touch, rock, and cuddle the infant throughout the hospitalization. Respiratory syncytial virus is a common respiratory virus which can spread commonly by touching, handshaking. The focus of question is on developmental stages of infant. According to infant stage, what intervention should nurse plan? So the correct option would be provide a consistent routine and touch, rock, and cuddle the infant throughout the hospitalization. So if we will provide consistent routine, we will make routine of the child and we will touch him we will provide him warmth, we will rock him and we will cuddle him. So this will lead to increase in the patient's trust. So the infant will be able to trust the primary healthcare provider. So in infant, there is development of trust versus mistrust. In this in this age, the patient has a condition. According to Erickson's theory, the patient has a level at which there is trust versus mistrust condition. So this is very important. In option one, Vaccine should be not given to the infant because this will make infant very cry, fuzzy, and will make him irritable. Home feeding schedule and allowing the infant to be held only by parents will not increase the bond with the healthcare provider. Wearing masks, washing hands when caring for infant, and keep the infant as quiet as possible. This is not needed because wearing mask is not helpful as it is not the airborne disease. Now we will see the rationale. A 10-month-old infant is in the trust versus mistrust stage of psychosocial development, according to Eric Erikson, and the sensory motor period of cognitive development, according to Jean Piaget. Hospitalization may have an adverse effect. A consistent routine accompanied by touching, rocking, and cuddling will help the child develop trust and provide sensory stimulation. Total body restraint is unnecessary and an incorrect action. Touching and holding the infant only when the parents visit will not provide adequate stimulation and interpersonal contact for the infant. RSV is not an airborne disease, therefore does not require masks and is usually transmitted by the hands. Next question. A child with a diagnosis of Reye syndrome is being admitted to the hospital. The nurse develops a plan of care for the child that includes which priority nurse's action. Options are 1. Monitoring for hearing loss. 2. Monitoring intake and output. 3. Repositioning the child every 2 hours. 4. Providing a quiet environment with dim lighting. Reye syndrome is a condition in which there is confusion, swelling in the brain, and liver damage. This usually occurs due to drug aspirin, or in child, this occurs in the patient who is recovering from viral infection or having metabolic disease. So the correct answer is providing a quiet environment with a dim light because patient has swelling in the brain. So it can lead to increase in intracranial pressure. So if we will provide a lot of stimulation in the environment and high flashlights, then this will lead to increased ICP and it will make patient irritable. So we have to provide quiet environment to the client. Monitoring for hearing loss is not an appropriate nursing action needed in this disease. Monitoring intake output is also not appropriate intervention. Repositioning the child every 2 hours is not a priority action. Let's see the rationale. Cerebral edema is a progressive part of the disease process for Ray's syndrome. A priority component of care for a child with Ray's syndrome is maintaining effective cerebral perfusion and controlling ICP. Decreasing stimuli in the environment would decrease the stress on the cerebral tissue as well as neuron responses. Hearing loss does not occur in clients with this disorder. Although monitoring intake and output may be component of the plan, it is not a priority in nursing action. Changing the body position every 2 hours would not affect the cerebral edema and ICP. The child should be in head elevated position to decrease the progression of cerebral edema and promote the drainage of CSF. So the three option is incorrect because we have to give position in which head is elevated. Therefore, the option 4 is correct. Next question. A nursing student is preparing to conduct a clinical conference regarding cerebral palsy. Which characteristic related to this disorder should the nurse plan to include in the discussion? Options are 1. Cerebral palsy is an infectious disease of the central nervous system. 2. Cerebral palsy is an inflammation of the brain as a result of viral illness. Option 3. Cerebral palsy is a chronic disability characterized by difficulty with muscle control. 4. Cerebral palsy is a congenital condition that results in moderate to severe retardation. So, in this question, a nurse is preparing to conduct for a clinical conference regarding cerebral palsy. So, to check that she has adequate knowledge about cerebral palsy, but what information she should include in the discussion. So, the correct answer is cerebral palsy is a chronic disability characterized by difficulty with muscle control. Rational. Cerebral palsy is a chronic disability that is characterized by difficulty with controlling the muscles because of an abnormality in the extrapyramidal or pyramidal motor system. Meningitis is an infectious process of the central nervous system. Encephalitis is an inflammation of brain that occurs as a result of viral illness or central nervous system infection. Down syndrome is an example of congenital condition that results in moderate to severe retardation. So the correct answer is option number 3. Option number 4 indicate Down syndrome in which there is moderate to severe retardation. If there is inflammation of brain, that it is meningitis. Okay. Sorry, if there is inflammation of brain, it indicates encephalitis. And infection in the CNS indicates meningitis. So the correct option would be 3. Next question. A nursing student is asked to conduct a clinical conference about autism. Which characteristics associated with autism should the student plan to include? So a nursing student has to conduct a clinical conference about autism. So what information she should include to define autism? Normal social play that ceases by age of 5, lack of social interaction and awareness, the consistent imitation of others' action, normal verbal but abnormal non-verbal communication. So autism is a condition in which child is not socially present. Therefore, the correct option would be lack of social interaction and awareness. So, rational would be autism is a severe developmental disorder that begins in infancy or toddlerhood. A primary characteristic is a lack of social interaction and awareness. Social behaviors in children with autism include a lack of and abnormal imitations of others' action and a lack of or abnormal social play. Additional factors include lack or impaired verbal communication and marked abnormal nonverbal communication. So, in option 1, normal social play is incorrect because patients do not develop social play from the birth. Consistent imitation of other actions is also incorrect because patient is not able to imitate others. Patient will have both abnormal verbal and non-verbal communication. So the correct answer is option number 2. Next question. Which interventions are appropriate to include in the plan of care for a child after tonsillectomy? Select all that apply. Options are 1. Offer clear, cool liquids when awake. 2. Administer pain medication as prescribed. Option 3. Monitor for bleeding from the surgical site. 4. Suction every 15 minutes and PRN as necessary. 5. Initially eliminate milk or milk products from the diet. Tonsillectomy is a procedure in which tonsils are removed. According to the question, what interventions are useful after the surgery? So the correct options would be offer clear, cool liquids when awake. So we have to provide clear, cool liquids. This will lead to decrease in pain in the child. Administering pain medication as prescribed. This will also reduce pain level in the body in short span. Monitoring for bleeding from the surgical site. This will lead to preventing the complications. Fifth, initially eliminate milk or milk products from the diet. So we have to eliminate milk or milk products because milk products are thick. They can layer up on the throat and make it difficult for the client to clear throat. So if patient will try to clear the throat, there will be increased pressure on the surgical site and can lead to bleeding. Therefore, eliminating milk and milk products is necessary. Suctioning is not needed as important as others. Suction is only needed if required, so it is not the correct answer. Rational. After tonsillectomy, clear, cool liquids are encouraged. Options 2 and 3 are important interventions after any type of surgery. Suction equipment should be available, but suctioning is not performed unless there is an airway obstruction. So suction is not important until there is an airway obstruction. Milk and milk products are avoided initially because they coat on the throat. This causes the child to clear the throat, thereby increasing the risk of bleeding. Next question. The school nurse is preparing to perform health screening for scoliosis on children aged 9 to 14. Which instructions should the nurse plan to provide to the children? Options are 1. Lie flat and lift the legs straight up. 2. Lie on the right side and then roll to the left side while arms are held overhead. 3. Walk 10 feet forward and 10 feet backward with the arms held overhead at both sides. 4. Stand with weight equally on both feet with the legs straight and the arms hanging loosely at the both sides. So we have to assess for the scoliosis. So we have to keep in mind that we are assessing spine of the patient. We are assessing back portion of the patient. So the alignment should be done properly to assess this condition. So the correct option is stand with weight equally on both feet with the legs straight and arms hanging loosely at the both sides. This will lead to easy assessment of the patient with scoliosis. Rational. To perform the screening test, the child should be asked to be strap or wear underpants only so that the chest, back, and hips can be clearly seen. The child is asked to stand with weight equally on both feet, with the legs straight and the arms hanging loosely at both sides. The nurse assesses the child's posture, spinal column, shoulder height, and leg length. Lying down positions and walking forward and backward are incorrect assessment techniques. Next question. The nurse is preparing a plan of care for a child diagnosed with leukemia who is beginning chemotherapy. Which intervention should the nurse include? First, monitor rectal temperatures every 4 hours. Monitor the mouth and anus each shift for the signs of breakdown. 3. Encourage the child to consume fresh fruits and vegetables to maintain nutritional status. 4. Provide meticulous mouth care several times daily using an alcohol-based mouthwash and a toothbrush. So, patient is undergoing chemotherapy, beginning chemotherapy, and patient is diagnosed with leukemia. So, what intervention we have to keep in the focus? So, the answer is monitor the mouth and anus each shift for the signs of breakdown. As the patient has to go under chemotherapy, so the side effects are formation of ulcers in mouth and anus. So we have to check mouth and anus every shift for the signs of breakdown. Rectal temperature monitoring is contraindicated in child because it can lead to vagal stimulation. Encouraging the child to consume fresh fruits and vegetables is not indicated because consuming fresh fruits and vegetables may contain some microorganisms. Fresh fruits and vegetables may contain some amount of microbes on it. So this will lead to infection in body as patient is having neutropenia during chemotherapy. Providing meticulous mouth care several times a day is important, but we have to use a non-alcoholic mouthwash because it can worsen the ulcers. And we have to use a soft bristle toothbrush. Rational. When the child is receiving chemotherapy, the nurse should assess the mouth and anus each shift for ulcers, erythema, or breakdown. The nurse should avoid taking rectal temperatures. Oral temperatures are also avoided if mouth ulcers are present. Axillary or temporal temperatures should be taken to prevent alterations in skin integrity. Bland, non-irritating foods and liquids should be provided to the client. Fresh fruits and vegetables needed to be avoided because they can harbor organisms. Chemotherapy can cause neutropenia, and the child should be maintained on a low bacteria diet if the white blood cell count is low. Meticulous mouth care should be performed, but the nurse should avoid alcohol-based mouthwashes and should use a soft bristled toothbrush. Next question. The nurse is preparing to admit a client from the post-anesthesia care unit who has had microvascular decompression of the trigeminal nerve. Which equipment should the nurse ask the licensed assistive personnel to make sure is at the bedside when the client arrives? So the patient had trigeminal neuralgia. For that, he had surgery of microvascular decompression of the trigeminal nerve. So we have to tell that what equipment are needed at the bedside of the patient. First, flashlight and pulse oximeter. Two, cardiac monitor and suction equipment. Three, padded bed rails and suction equipment. Four, BP cuff and cardiac monitor. So the answer would be flashlight and pulse oximeter. These are needed because we have to check oxygen saturation of the patient after surgery. And flashlights are used to assess the neurological status of the patient. We will put flashlight in the eyes of the patient to assess the neurological condition of the patient. Cardiac monitor and suction equipment are not needed unless patient is of any cardiac history. Padded bed rails and suction equipment. Padded bed rails are not needed. Padded bed rails are needed in the case of seizures. BP cuff and cardiac monitor. This is also incorrect because it will only be needed if patient has any cardiac disease. So rational. The postoperative care of the client having microvascular decompression of the trigeminal nerve is the same as for the client undergoing craniotomy. This client requires early neurological assessment as well as monitoring of the cardiovascular and respiratory status. Therefore, a flashlight and pulse oximetry are necessary. Items. Cardiac monitoring and padded bed rails are not indicated unless there is a special need based on a client history of cardiac disease or seizure, respectively. Suctioning is performed cautiously and only when necessary after craniotomy to avoid increasing the intracranial pressure. So in this session, we have discussed 30 questions. I hope it helped you. Thank you.